Welcome, everybody. We'll be getting started in just about 2 minutes. Okay, we're going to go ahead and get started. Welcome to everyone, and welcome back to those of you who joined us for the earlier sessions today. We have our third session beginning now when school starts back, helping students cope with crisis and loss during the COVID-19 pandemic. I do just want to take a moment before I introduce our presenter to remind you that you have the ability to pose questions to our presenter, which we'll ask him towards the end during the Q&A period, and we ask you to use the Q&A function to present those questions. Additionally, you have the opportunity to communicate with each other and with the other panelists using the chat function. You can share your impressions, your thoughts, your feedback, also any resources that you're aware of in the chat function. And you do have the ability to control who sees your chat. So when you go into the chat next to the two, there's a drop-down list and you can select panelists, which will only allow those of us who are panelists to see your comment, or you can select panelists and all attendees, which will allow all of your peers to also see your chat. So with that being said, we'll get to the presentation here. We have Dr. David Schoenfeld with us. We're very happy to have him with us today. Dr. Schoenfeld is a developmental behavioral pediatrician and professor of clinical pediatrics at the Keck School of Medicine of USC. He's authored more than 150 scholarly articles, book chapters, and books, including The Grieving Student, A Teacher's Guide. And he's given more than 1,000 presentations, maybe even just 1,000 presentations since the pandemic started on the topics of pediatric bereavement and crisis. He's provided consultation and training in the aftermath of school crisis events and disasters within the US and abroad. And he's established and directs the National Center for School Crisis and Bereavement. This is his area of expertise, and we're very happy that he is able to bring it to bear for us on the current circumstances. So thank you so much, Dr. Schoenfeld, for being with us, and I will turn it over to you.
Thank you very much. So as mentioned, I'm going to talk about really what should we be thinking about now that schools are starting back, and particularly how do we help students cope with both crisis and loss during this current pandemic. If you could advance to the next slide. So what I plan on covering today is I'm going to start by talking about principles of psychological first aid as one strategy for helping you figure out how to structure your initial interactions with students and children. We'll talk about some of the common reactions that you may see to a crisis event in general and specifically as it relates to this pandemic. I'll talk about some practical suggestions then for helping children cope with the pandemic, and then I'm going to turn to how do we support grieving students, and I'll end by giving you some information about some free resources related to the Coalition to Support Grieving Students. If you go to the next slide. I mentioned psychological first aid, and in the immediate aftermath of a major crisis event, psychological first aid should be provided broadly to all those who are impacted. And it involves offering psychoeducation, that's just giving information to people and helping them understand what should they expect from a crisis and the reactions, and more importantly, what can you do to cope with these events. Psycho at PFA also involves offering supportive services. And together what you're trying to do is promote effective and normative coping strategies and adjustment. In many ways, you're just trying to accelerate the natural healing process. It isn't a treatment approach, but it's a supportive approach. All adults who are working with children should understand the likely reactions from a crisis event and how to help children cope. If you go to the next slide. The point I'd like to make is that anyone that interacts with children and their families can be a potential source of assistance and support. But if they're unprepared, particularly if they appear disinterested or unconcerned, they can actually turn into a source of further distress. Talk about the fact that I had done a lot of training around the country for different places, but one that really stayed with me was I did some training for the Flight 93 Memorial. For those of you who don't recall, Flight 93 was the flight that was en route to Washington, D.C. on September 11th, 2001. And the passengers and crew became aware that they had terrorists on the plane, and they were also aware of what happened with the World Trade Center attack. And collectively, they decided that what they would do is take the plane down and sacrifice their own lives so that they didn't do more damage in a highly populated area, in this case, Washington, D.C. So they sacrificed their lives and crashed the plane outside of Pittsburgh. And there is a national park that's dedicated to their memory and a visitor services there and a kind of a small museum, which you can go there and learn more about this sacrifice. But anyway, I was doing training for the staff there. And this included all of the staff. And again, it's a national park. And at the end, one of the staff came up to me and explained that he oversees a number of people who keep the grounds for the park. And he said to me, you know, I have trained my staff that if they see a visitor, they're to stop what they're doing, establish eye contact, and inquire if they can be of assistance. And he looked at me and said, we're not here for the lawn. This is sacred ground. We're here for the visitor experience. Now, if you can train people who cut lawns for the National Park Service to have that kind of broad perspective of what their role is, I would say anybody who works on a campus for a school should know they're there for the student experience. And they should stop what they're doing, they should establish eye contact, and they should see if they can be of assistance. This is particularly the case in a crisis event. Quite honestly, it should be what you're like baseline. So let me go over, if you advance to the next slide, some of the steps of psychological first aid. And this is as described by the American Red Cross. The first is observation and awareness. And I'm going to go over some of the common symptoms of adjustment difficulties. You then want to make a connection. You want to help people feel comfortable and at ease. And you want to be kind, calm, and compassionate. People tend to pick up more on how we present ourselves when they're in crisis and what we actually say when we're describing the crisis event to them. I remember being the attending in an emergency department at a children's hospital, and a child had come in after an injury in a baseball game. He was brought in by ambulance, independent of his family, because the injury happened at school. And then his mother arrived. And I sat down with her before she went in to see her son and explained what happened. And I'm told I have a very calming presence, so I talk this way, the same type of pacing. And I just said, let me explain what happened. Your son was playing baseball and he was hit by a bat in the head very hard. And because of that, it caused a small break in his skull or a fracture. And the inside of our skull is lined with a lot of blood vessels. And as a result, one of the blood vessels ruptured and it's bleeding inside his skull. The blood's collecting and it's pushing down on the brain, and that's an emergency. So he has to go to the operating room and they have to remove that blood so it doesn't cause any damage. With the other thing that we do while we're waiting for the surgery is we need him to breathe very quickly, to hyperventilate. And the way we do that is we sedate him, we put a breathing tube down into his lungs or his airway, and we hook him up to a ventilator. And so he is now on a ventilator, and so that the machine can breathe more quickly for him. And that's basically what I said. And I just asked her, do you have any questions? And she just looked at me and she said, is he going to have to stay overnight? And I thought that she really wasn't getting what was going on. So I brought her back. I mean, he was bruised, he was intubated, he was unconscious. And, you know, someone came in and asked for permission for the surgery and for anesthesia. And then she just she signed all the paperwork. And then she looked at me and she said, should I go home now? She really wasn't understanding how serious this was. And in that particular case, I think it was actually too calming. So I actually then started to talk a little bit more agitated. I said, ma'am, this is really serious. Sometimes people don't survive these injuries. And then she was like, oh, then I better stay. And I was like, yeah, I think you should. And then I just went back to being calm. So the issue is people will pick up on how we speak more than what we actually say when they're overwhelmed, or it's just confusing for them. So we want to make sure that we match our presentation to the way we want them to be feeling at the time. And if that's calmer, then we have to present as calm as well. The next point on here is to assist with basic needs. And that may be, for example, in the pandemic, making sure they have food or that they have access to medical services. I remember during one of my trips to New Orleans after Hurricane Katrina, someone told me that they had been at church on Sunday, and in the middle of the minister giving his sermon, someone's cell phone went off in the audience. People made, comments to each other, and there was a lot of murmuring about how inappropriate it was to leave your cell phone on. And apparently the minister stopped the sermon, turned to the congregation and said, you know what, that call might be your contractor. You better answer it. So what he communicated to his congregation was literally, even the word of God is not as important as making sure that you're safe, that those basic needs are really fundamental. And the person who told me this said, you know what, my minister really gets us. And that's what you want. In a crisis situation, you want the students, the staff, the parents, everyone to know you get what they need. And that often means focusing on basic services first. You then want to listen, and being able to actively listen is far more important often than knowing exactly what to say. You want to give realistic reassurance, not false reassurance. And then you want to encourage good coping. And I'm going to review some coping strategies later. You want to then help people connect. So help them identify supports in their family and in the community. And if you're working in a school setting, obviously resources within the school. But you also want to help them figure out how best to help others. And I'll come back to that later. And then as a crisis is evolving in particular, you want to give them accurate and timely information, but you don't want to give unnecessary or graphic details. If you could advance to the next slide. During this time, we really all need to watch our media consumption. And again, if you could advance one more slide. We want to make sure that our media consumption represents a healthy diet and that we don't consume too much of it. Adults should try to keep informed through focused but periodic attention to trusted media outlets or other trusted sources of information. Don't listen to, watch, or read continual coverage, even though it is available. This pandemic is going to be here for quite some time, and I think people are just going to get overwhelmed and exhausted if they try and keep up with all the information, if they haven't already gotten to that point. It's good to remember there are two main reasons to listen to, watch, or read media coverage during a crisis such as this. One is to be reassured, and the second reason is to learn practical steps to keep yourself or those you care about safe. So if you're watching media and you aren't getting more reassured or learning practical information about actions that you need to take, then disconnect from media, whether that's television, radio, print, or social media, at least for a period of time. Advise children to also limit their amount of media exposure. This is actually a good time for everyone to unplug to the extent that they can and connect instead with family and friends. It'll allow parents to focus on their attention on their children's needs and allow them to provide and receive support. So if you can go back to, just go to the next slide, this will return us back to those same steps for PFA. I just want to go over the last two. The next one is to suggest a referral resource. So again, be aware of school and community mental health resources so you can offer them to students and families, and then end the conversation. I probably should have said this. Psychological first aid is actually something that's usually provided by strangers who are not mental health professionals to other individuals that they don't know and won't have an ongoing relationship with. So that's why the last step is sometimes the hardest, which is ending the conversation. And you really need to refer them on to others who can provide more support to them as the crisis unfolds. All of these steps are generally done in about 10 minutes, and again, don't require a pre-existing relationship. And so if you think of some of these strategies and approaches, you can apply them to students that you have an ongoing relationship with, and that will be in some ways even easier. And so then the ending the conversation is not as difficult if you can continue it at another point. So these are some of the steps of psychological first aid. And before I go over some of the symptoms that you're going to see in a crisis situation, I wanted to explain that parents and other adults that support children, such as educators, often underestimate the extent of children's reactions to a crisis situation, especially related to what we refer to as internalizing symptoms, or how they feel. We can do a decent job if we're really careful at observing behavior, but we cannot do as good a job in observing feelings because they're not clearly evident. So one of the reasons for that is that children may withhold complaints of their reactions because of concerns that they're abnormal or somehow inappropriate, or because simply they wish to protect their parents or other adults who are visibly upset. Adults, including educators, often avoid discussion of troubling events in order not to contribute in some way to student distress, afraid that they're simply going to upset the students or say or do the wrong thing and make matters worse. But saying nothing is precisely the wrong thing to say in a crisis setting. It communicates to students that adults are either unaware, unconcerned, unable, or perhaps worst of all, unwilling to be of assistance. So if you can go to the next slide. So it's actually, if you go back one, I think, just go back one, that's the correct slide. So it's helpful to anticipate some of the common reactions to a crisis that may be seen among students, and I will say you will see them among adults as well. And some of them are listed on this slide. But to be quite honest, the most common reaction is not on this slide, and that's nothing. As I already mentioned, in most cases, you will not actually see the distress that people are experiencing. But let me go over some things that you can see. So the first is fears related to the pandemic and anxiety. The fears, of course, may be a fear of becoming infected or getting sick, getting seriously ill or dying once you are exposed or infected. But you can also get anxiety, and anxiety will include fears that are not specifically related to the crisis. For example, you may see for children and even adults become more fearful of the dark. It doesn't have anything to do with the infection, but it's just a fear that people have developmentally, and fears increase when you're anxious. We may also see school avoidance after any type of crisis event. Children may be reluctant to separate from parents or other caregivers for fear that something may happen if their parents aren't there to protect them, or something may happen if they aren't there somehow to protect or shield their parents. After sheltering at home for an extended period during the pandemic, though, when students do return to school physically, we should expect that many of them are going to be afraid to return to public spaces such as schools, particularly while the virus is still circulating. And many parents, in turn, are going to be reluctant to send their children, and kids will pick up on that reluctance. So it's going to be important that we reach out to students who don't show up when schools reopen, especially if we're expecting them to return in person. It's also important to stay connected with students now and until students return physically, and seek support for those of whom you already have concerns about, such as those who didn't attend or engage in virtual classes, or somehow didn't submit assignments as consistently as they did prior to the pandemic. So sometimes the kids we don't see are the ones we should be most concerned about. You can also see sleep problems, and that may be trouble falling asleep or staying asleep, difficulty waking in the morning, nightmares, or other disruptions in sleep. And when people don't sleep well, they don't function well the next day, and sometimes for several days. And so making sure that there's good sleep hygiene and that you're creating an environment and a situation where kids are most likely to be able to get a good night's sleep becomes particularly important And so a lot of attention I find, but probably the main complaint that I do get from parents after school crisis events, whether that's school shootings or natural disasters, and I think also in this pandemic, I'm seeing it a lot too, is that kids aren't sleeping well. So we want to make sure we give attention to that. I do want to say that I am a physician, but I have never written a prescription for medication for sleep in the setting of crisis or loss. And so I'm not suggesting that we need to be medicating individuals to make them sleep, but I do think we want to pay attention to sleep hygiene and good sleep practices and rituals. And I'm happy to answer questions later about that. In addition to changes in sleep, you may also see changes in appetite or eating, either eating more or eating less. You can see difficulty with concentration. Some of this is related to sleep, but some of it is also just related to stress, even if people are sleeping okay. And that difficulty can lead to problems in academic performance for students and work performance for school professionals. As you can imagine, you can see sadness and depression among children. So we should be considering such things as risks of self-harm and suicide, and figuring out how to evaluate and attend to that even when schools are not physically open. You may see anger or irritability in students as well as adults. Individuals who are highly stressed are often less tolerant of change, unpredictability, or additional stress. But unfortunately, we're going to see an increase in all three of these during the pandemic. Individuals who are highly stressed may also show distrust or suspiciousness. And these reactions can challenge pre-existing relationships among friends, colleagues, and family members, but it also makes it hard to form new relationships. So as students return to new classes and have new teachers, it may be hard for them to form the relationships in the same way they did before the pandemic because of the stress associated with it. You can also see the new onset of or increase in alcohol and other substance use. So you should ensure that substance abuse evaluation and treatment services are part of your recovery strategy in the school. And you should keep that in your differential when you're trying to figure out why a child may be distracted, sleepy, unable to engage, etc. I would also explicitly discourage the use of alcohol for relaxation or socializing in school-sponsored activities during the recovery process. I actually remember talking to one school early on in the pandemic, and the school administration had actually sent wine through the mail to staff in the school. And I explained that I probably would not be distributing alcohol during a crisis situation. I often talk about the fact that when I was in New Orleans during one of my visits after the hurricane, I was doing a presentation and I mentioned this point. And afterwards, a mental health provider came up to me and said, you know, that reminds me of what happened to me. And the individual said, you know, it was about 2 weeks after Katrina and my daughter called me on my cell phone to ask where I was. And I told her I'm with some of the people from the school. We're at happy hour at a bar nearby. And apparently the child just said, Mom, you've been at happy hour every day since Katrina and you don't seem happy at all. And she said, at that point, I realized I was drinking too much and she hadn't made that connection. So I really do encourage people, I don't think it's a good idea to be having virtual happy hours where you're asking people to drink alcohol as a way to kind of process some of their stress associated with the crisis. I'm not saying individuals can't drink alcohol in moderation, but I'm saying I probably wouldn't be encouraging its use as part of a school-sponsored recovery activity. Next on this list is physical symptoms, and that could be headaches or stomach aches or fatigue. Part of the challenge is that may be due to psychological distress that presents as physical symptoms, but it can also be due to the impact of the stress hormones themselves. Stress hormones can increase blood pressure and worsen hypertension. They can increase respiratory problems and precipitate asthma attacks. They can also, they can interfere directly with sleep and cause fatigue during the day. So what complicates this even more with COVID is a lot of those are also symptoms of the infection. So if a child's feeling short of breath, you have to sort out, is it psychological distress? Is it worsening of their asthma? Or is it a problem with the virus itself? And so this is one of the challenges I think that school nurses and others are going to find in schools, and that physicians and other healthcare providers are going to be struggling with as well. The next symptom I have here is grief, and I'm going to discuss that separately later. And then the last one on this list is guilt. People somehow manage to find reasons to feel guilty in crisis events, irrespective of their actual experience or role. And at some level, at least unconsciously, it may actually seem easier to feel responsible for something you did, didn't do, or should have done to prevent someone you care about from getting infected, ill, or having a serious outcome from the illness, rather than to accept the alternative, which is it had nothing to do with you. Because if it has nothing to do with you, that means it could happen to someone else you care about, and there's actually nothing you can do to prevent it. So sometimes people would, at least unconsciously, prefer to feel guilty because it gives them an illusion of control. And that may provide some initial reassurance, but it is an illusion, so it doesn't actually help prevent others from getting ill, and it leaves the person with guilt that impairs their adjustment. So I've seen guilt very commonly after deaths have occurred and other crisis events. I also see survivor guilt, as well as guilt because the individual hasn't experienced loss or trauma to the same extent they perceive others have. So guilt is quite common. Now, all of the reactions that I've just mentioned may be due to the pandemic itself, but it may also be due to a wide range of other stressors that are associated with the pandemic. For example, the financial impact of unemployment or partial employment may cause concern among parents that children pick up on. Or the stressors associated with the pandemic, such as the financial concerns, may increase arguments among adults in the household, contribute to parental anxiety, depression, mental illness, or substance use, or even contribute to domestic violence. So during the pandemic, don't just look for students who have had a family member who became ill or died, but ask students more broadly how they're doing overall. So these are some of the things that you will see in a crisis event such as this pandemic. So let me turn now to some basic advice on how do we talk to and support students during the pandemic. If you could advance the next slide. First off, don't pretend that everything is okay when clearly it isn't. Children can pick up when parents and other adults are not being genuine and honest, and they're going to be less likely to ask questions or seek advice when they feel that's the case. Children benefit from knowing that their parents and other important adults in their lives, such as classroom educators, have similar or at least different concerns. And most importantly, they need to learn how the adults deal effectively with their own troubling or distressing feelings. We can't expect children to share their deepest concerns when we are unwilling to share ourselves that we even have concerns. And we certainly can't help them learn how to cope effectively with distress if we don't ever model effective coping strategies. But this doesn't mean that adults should share all of their concerns. And I'm not suggesting you should tell them everything that's bothering you, but rather tell them how you're dealing with what is bothering you. Some concerns are actually primarily those of adults, such as related to how the pandemic may impact employment or income of parents and other extended family members. And I would suggest that the adults discuss those concerns privately. But if kids do pick up on them, then you may need to explain how it is relevant for them. What we really need to do is to find out the individual child's fears, concerns, or their skepticism. Children actually may have very different fears or concerns than adults do. And you can't reassure people in general, and children specifically, if you don't know what they're actually afraid of or concerned about. Otherwise, you usually aren't actually offering reassurance, but rather you're telling them why you aren't worried. And when two people each talk only from their own perspective in a conversation, we call that arguing. And arguing is not a very effective way to be reassuring. You don't want to tell students that they shouldn't be worried or attempt to minimize their concerns, but instead explore their concerns and help them learn to deal with their uncertainty and their fears. Share with them strategies to deal with distressing feelings rather than pretend that they don't or shouldn't exist. Be sure in your conversations to include positive and reassuring information to the extent you can, and present overall, at least, a hopeful perspective. This actually is not a good time to convey to students a strong criticism of the government's response to date or your personal candid assessment of the leadership of those in public office, unless the students are asking you specifically for advice on how to vote in November. So try instead to convey that you do hope and you expect that at least overall, scientists and public health officials are learning how best to handle the situation, and that you anticipate that your school, your community, your state, and the country will ultimately be making decisions to address the pandemic effectively. Go into the next slide. You should explore with students different strategies of dealing with distress, discomfort, anxiety, and sadness, some of which are listed on this slide. That might include reading or hobbies to help promote healthy distraction. Also includes talking to others, journaling or blogging, art and music, and other means to promote the expression of feelings. Point is, you need to do both. Sometimes you need to talk about and process your feelings and your thoughts about the difficult situation. And other times you just have to take off from that and step away and practice healthy distraction. I just use healthy distraction to explain that alcohol, tobacco, and other drug use are not healthy forms of distraction, so I don't recommend those. But healthy distraction, you do need to engage in. The problem, of course, is if you're sheltering at home and there are just a couple people there, or say 2 people, and one wants distraction and one wants to talk, you can imagine that can cause a conflict. So you just need to recognize both are appropriate, but they may not occur at exactly the same time, and people need to compromise. And so sometimes you have to say, I need some distraction right now, but I'm going to talk with you in about 20 minutes. Let me just go jog around the block, and then I'll come back and we'll talk about how you're feeling. Other techniques include things like exercise and yoga, the appropriate use of respectful humor, relaxation techniques and mindfulness, which can be taught even to very young children. Now, many of these techniques are really best learned when people are not experiencing high levels of anxiety or distress, because they do involve practice and coaching, and frankly, they're just easier to master when you're not under stress. But actually, the principles can be introduced and basic skills learned, even now in the midst of the pandemic. We also want to help children identify developmentally appropriate things that they can do to personally protect their own health and to help others. We have to recognize that when children go back into school buildings, they're not going to have adults there to watch them every minute to make sure that their masks are appropriately on and positioned, and that they're washing their hands properly each time. So they need to learn those skills at home and start practicing them. Hopefully they've already been doing that, but we also want them to be able to help others. So for younger children, let them pick out the soap they prefer to use to wash their hands, and let them provide some input into their hand washing routine, such as picking what song they'd like to sing. I'm not trying to be critical. I don't know who came up with this suggestion, but to be quite honest, if it's your birthday during the pandemic and you can't have a birthday party and meet with your friends and family to celebrate, probably the last song you'd want to sing every time you wash your hands for months is Happy Birthday. So let them pick what they wish to sing or what they wish to do to make sure they're washing their hands properly. For older children, you can identify even more ways that they can safely help others, just such as dropping off food outside the door of elderly neighbors or making regular phone calls to speak with grandparents who are feeling isolated. If children can contribute to the response in a way that they feel is effective and appropriate, they're just less likely to feel helpless. And finding ways to help others can also help children feel some sense of personal agency during a time when many of us are feeling powerless, including them. If you go to the next slide, I've talked about what you can do for children in general, but the reality is some children may require more assistance. And the pandemic and discussion about the impact it's having on families may remind children and adults of other difficulties in their lives, whether that be events in the past, ongoing challenges, or simply concerns about future losses or crisis. And these children may find this time to be particularly difficult and require more assistance. Students who were anxious or depressed prior to the pandemic will likely need even more support. So we should encourage families to reach out to their mental health and pediatric health providers by phone and email to get advice and support. We need to also recognize that when children are highly stressed, they may regress socially, act less mature, become more demanding or selfish, or just have more difficulty getting along with peers and family. Some students may actually appear disinterested. You may see this among teens. They may say, I don't really care. It's no big deal. I'm fine. I'm not worried about it. And they may appear disinterested because they actually are overwhelmed with their own personal concerns. They may need to focus first on their own needs. What does this mean for their college plans, their vacation, their sports, hobbies, friendship networks? They may need to concentrate on these things first before they're able to start to think more of the needs of others. This is actually often a sign that they're under stress and having difficulty coping, not that they really are not impacted. We need to warn adults, try not to make them feel guilty for thinking about and sharing their personal distress about how the crisis impacts them, even if the impact is far less than it is on others. You can imagine, for example, a student complaining that it's just not fair because they can't celebrate their birthday during their summer break because of the pandemic, and have a parent just get frustrated and say something like, well, you know, there are kids who experience the deaths of people they love. You should be thankful that's all that happened to you. That's pretty selfish. And then you can just imagine that the kid's gonna feel guilty as a result. I assure you, it won't make them feel any better about missing their birthday party to know that somebody's experienced a death. It doesn't really help you enjoy your birthday anymore. It makes you feel guilty, and it makes it less likely that you're gonna share your concerns with your parents. So it's not a good approach. And you might ask, why would adults do that? One of the reasons they do it is they're going through the same stress, and they are also not functioning as well as they were before, and they may just be easily frustrated and overwhelmed. So while crisis response can bring out the best in people, I've done a lot of this work, it tends to bring out their stress. And so we likely won't be at our best at least all of the time. And being around people who are needy, demanding, self-centered, or distressed actually isn't fun or particularly satisfying, and it can be very wearing on adults. So what you have to try and do is be patient with students, their families, the staff, and overall, you have to be patient with yourself. We should appreciate what impact all of this is having on us as adults, and educators and other school staff are likely going to have the same concerns about their own health or those of family member and friends. And I encourage you, please do what you can to address these needs. Don't just focus on the needs of your students. School staff are most likely to feel overwhelmed when they feel unable or unprepared to provide meaningful assistance. We have to remind ourselves there's a lot we can do, even in the midst of an evolving pandemic. While we can acknowledge the limitations in our current knowledge and our current resources, we shouldn't minimize the value of our guidance and the assistance we can and do provide. If you advance to the next slide. The reality is, just because we don't know everything doesn't mean we know nothing about you. You all know strategies that have helped in the past to decrease students' distress, and you should try some of them now. You may not feel that what you can offer, especially remotely, is enough. And students may want, and they may even need more than you can provide at times. And then reach out to colleagues and resources in the school, school district, and community when you feel more is critically needed. But all of us should still try to recognize and celebrate the positive contributions you can and you do make. The moments you're able to help a child smile, even if it is only for a moment, or help them learn something so they feel a sense of accomplishment and growth during a period of time they would otherwise just feel overwhelmed. But we also have to try to set reasonable expectations and communicate these to students, parents, educators, and other school staff, and accept them ourselves. Students are not going to learn as much schoolwork during this time period as they would have had we been able to keep schools in session and we weren't in crisis. So don't try to keep the same pace of learning, or this is just going to overwhelm students and educators, and then their time together becomes a source of distress rather than a source of comfort and assistance. And I'm going to warn you that when schools do resume in person, you're not going to be able to catch up and teach everything you missed. Students will still be stressed, educators will still be stressed themselves, and people will not learn at the same rate as they were learning prior to the crisis. With all this discussion about whether or not we reopen schools physically, I've heard a lot of people say, well, the kids have already lost some learning. But I'll be honest with you, I've responded to major natural disasters and large-scale school shootings over the years. And even when they do reopen schools the next day, kids still don't make the same academic progress, because a lot of this is due to stress, and that's going to persist, even if we are physically present. But even if people came back to school and they were physically present, the pandemic somehow is magically over and everyone was back to doing well, you still wouldn't be able to make up for the time that you lost. Kids can accelerate their learning to a level to catch up for all the months of compromised learning that preceded that. We have to recognize that at some level, at least for this time period, the curriculum has changed. If we're teaching students how to cope with distress and adjust to a major crisis, we're actually helping them learn life skills that are going to make them more resilient in the future and more able to deal with future adversity. And in the end, to be honest, these are the lessons that are going to be most important. Now, the pandemic is also causing not just stress, but a considerable number of deaths. So I want to turn now to how schools can provide a supportive environment to grieving students. And I want to start by saying that this doesn't require that classroom educators provide bereavement counseling, but rather that they provide an empathic presence. I often tell a story about I was interviewing one teacher, and she told me about a student who returned to school. He'd been out for a week because his mother was ill. And the teacher knew that the mother was in the hospital, but didn't realize that the mother had actually died during this time period. So when the student came back to class, he informed her that his mother had died. And she said, you know, she felt so sorry for him. And she said, I gave him a hug and I told him, I'm here for you. I asked him how I could be of help. And apparently the student just looked at her and said, please stop. Like, he did not want this attention. And so she said, okay, well, please know I'm here for you. My door's always open. And that's the same for everyone in this school, whenever you'd like to talk. Well, he didn't come back to talk about it. But 2 weeks later, he did stop by after school and just looked at her and said, I just wanted to say thanks. And she looked at him and said, thanks for what? And he said, I just wanted to say thank you. So she said, okay, I don't know what you're thanking me for, but you're welcome. And he said, you were here and I didn't have to talk about it. So she said she realized then that sometimes kids don't want to talk about it, but they do want to know you recognize what's happened and you're there to help them. And she said that it's kind of like a dance. I take the first step. If the student's ready and takes the next step with me, we continue the dance. If not, that's fine. We can just stop and listen to the music together. And I think that's a lot of what educators are going to be doing when schools reopen. We're just going to be listening to the music together. It affects all of us. And so we don't have to solve the problem. Sometimes we don't even have to talk about it. We just have to acknowledge it's there and acknowledge that we're going to offer assistance and be there to provide that assistance. So first, when the death has occurred, it's important to acknowledge the loss. There's a common myth that talking to children about their loss is going to upset them. But when you ask students how they're feeling after someone has died and they cry, they're not crying because your question upset them. They're crying because they're upset about the person who died. And you're just allowing them to express how they're feeling. So what I would do is, I mentioned earlier that students may not show their distress in the aftermath of a crisis. And similarly, students may be reluctant to share their grief with students for a wide range of reasons. Actually, if you go back, I'll tell you when to advance the slide. Even before that one, we're still on the one before. So students may be reluctant to share their grief with adults for a wide range of reasons. But even when educators are aware that a student is grieving, they may not think they know what to say to make things better. And they're often afraid they're going to say the wrong thing and unnecessarily upset students or make matters worse. So I often find it's helpful to review some well-intentioned comments that might not be best to share with grieving students. If you go on to the next slide. Actually, one more. Okay. So first off, try not to cheer up survivors by making statements such as, I know it hurts very much right now, but I know you're going to feel better within a short period of time. Instead, allow them to experience their grief. Anything that begins with at least should probably be reconsidered. At least he isn't in pain anymore, or at least you still have a sister, is just trying to minimize the distress that they're feeling. Don't encourage them to be strong or cover up their emotions. For example, by saying things like, you know, you need to be strong for your mother now, you're the man of the house. What you want is to allow them to express their distress without feeling uncomfortable about it. You should feel free to express your own feelings and to demonstrate empathy, but don't state you know exactly how someone else feels. Comments such as, "I realize this might be extremely difficult for you," or "I can only imagine how hard this must be for you and your family," can demonstrate empathy appropriately, and they're open-ended. But I would avoid statements such as, "I know exactly what you're going through," because you can't know. They have to tell you what they're going through or feeling. You don't want to say something like, "You must be angry," but let the individual express their own feelings. Don't tell them how they ought to feel. It's also best to avoid comments such as, "Both my parents died when I was your age." When you share your personal loss experience in this way, it tends to set up a comparison with the experience of the grieving student. And when you make such a comparison, there are really only two basic ways that can go. You may say something that pales in comparison. So if the teacher says, "I understand what you're feeling, my dog died this weekend," the child may be insulted by the comparison if they had a family member that died. But the opposite can also occur. Students who experience the death of a grandparent, for example, but then are told by their teacher that both of the teacher's parents died when they were that age, may actually feel that their loss is somehow less profound or less important. And it may actually make the grieving student feel they need to support their teacher. You really don't want to compete with the survivor for sympathy, and I know that's not the intention. So just try and keep the focus on the child and the child's experience. Now, this advice is really related to what if you're a school professional or a mental health professional, and not to be crass, but you're paid to take care of the kid. And in that case, the experience is really all about the child's experience and not about yours. Obviously, it's different if you're talking to your own children, if you're talking to friends and family members, where there you're trying to receive mutual support. So you're providing support, but also receiving it, in which case talking about your personal experience may be much more relevant. What you want to do in a school setting, though, is allow the child to be upset and suspend your judgment. Don't try and judge, is it normal or abnormal, but just intervene when safety or health is a concern. Suicidal or homicidal thoughts or behaviors should be promptly evaluated by school mental health professionals, even when they occur in the setting of acute loss. But allowing students to show their distress without trying to cheer them up is honestly particularly difficult for school professionals who don't really like to see students in distress. Go on to the next slide. Some people are also worried that they're going to say or do the wrong thing because they feel somehow ill-informed about another person's culture. And although there are differences in cultural practices, the fundamental experience of grief is actually universal. When we recognize there is a range of ways to experience and express grief, we can explore ways to bridge some of these cultural differences in order to help grieving students and their families of all cultures. We go on to the next slide. Ask questions when you're unsure what you think would be most helpful for a family or individual. But the reality is that assumptions based on what you believe a particular ethnic group, religious group, or cultural group may use as mourning practices may actually result in stereotypes that cloud our perceptions and make us miss opportunities to be helpful. I had the opportunity to provide some support to an Amish family, and I was doing a lot of this by phone, and then I actually went and visited them. It was out of state. And while I was at the home, this was actually the home of the grandparent, she was showing me around her house and telling me more about the Amish culture and about her family. And at one point, she stopped and pointed to a picture that was framed on the wall. She said, "This is a picture of my granddaughter that was murdered." And what she told me was that at one point, the grandchildren were over and they were outside playing, and she went to check on them. And a tourist had stopped and he was a photographer, and he was taking pictures of the children. And so she told the photographer to please stop taking photographs. And she explained that it violated their religious and cultural beliefs and practices, and they were considered graven images. She said, "Please don't do this." But apparently her granddaughter was about 5, was so excited, and she begged her grandmother to please let him take the picture and said he promised to send a copy. And she said, "I was so embarrassed that I just relented and I let him take that picture, even though it was against our practices." And then she paused and she pointed to the photograph that she had framed on the wall. And she said, "What a gift from God. If I hadn't allowed that to happen, I wouldn't have a picture to remember my granddaughter." Now, the point is that I did know that Amish people generally don't use photographs as transitional objects to help grieve with their grief because of their religious and cultural beliefs. But if I had presented that knowledge or presumed that's what the family was doing, how would she ever have had the opportunity to tell me that was exactly what she was doing? So I tell people we should approach the family with an open mind and an open heart. Help them identify and communicate what's important to them about their cultural practices, and then work to find solutions and compromises whenever realities require modifications. For example, during this pandemic, it may not be safe to have family members clean or prepare the body for funeral, hold large funeral ceremonies, sit Shiva, or visit grieving families to bring over food. But what we have seen already is the use of virtual services, even virtual Shiva, in coordination of meal delivery through online services. So we can find out what those cultural practices aim to accomplish, and then we can see, can we do them? And if we can, how can we modify them to make them work better? Now, if you turn to the next slide. So after reviewing why you should say something and some guidelines of what not to say, here are some practical steps to help get the conversation started with grieving children. So the first thing is express concerns. Let students know that you've heard about their loss and you're available to listen and offer support. Be genuine. Children can tell when adults are authentic in their communications. For example, don't tell a child that you'll miss her uncle too if you've actually never met the man. But you can honestly say to a child that you're sad that she's experienced the loss of someone important to her. Invite conversation. So use simple, direct, open-ended questions. Simply saying something like, how are you doing? And how is your family doing since your mother died? Is a good way to start the conversation. And then listen and observe. Listen more and talk less. Share observations about students' behavior or responses in a non-judgmental manner when you do wish to do so. So you can say, for example, I noticed that since your mother died, you've been quieter in class. I'm wondering, how are you doing? So you can share an observation, but it's non-judgmental. So I wouldn't say you're not talking as much as you should in class, because that's judgmental, but you can share observations of change. You'll want to limit your personal sharing, as I've already discussed. So draw on your personal experience to help you better understand that of others, but mainly keep those experiences to yourself and keep the focus on the student. You can also offer practical advice. For example, discuss ways to respond to questions from peers or adults about the death, or you could go over with kids, what to say and what not to say. The same ones that I already went over with you. You can also then offer reassurance. Without minimizing their concerns, you can let students know that over time, they'll probably be better able to cope with their distress and that you're going to be there to help them through that process, and then maintain contact. Realize that at first students may not accept our invitations to talk or our offers of support, but their questions and their needs will evolve over time. So remain available, concerned, and connected. If you go on to the next slide. When supporting grieving students, it's helpful to identify a couple things, and one of them is guilt reactions. Young children tend to be very egocentric, and they assume that they control external events through their own thoughts and actions. And they also have a limited understanding of the true cause of death. In order to make some sense of the death of someone close to them, children often elaborate explanations that rely on what we call magical thinking, and assume there was something they did, didn't do, or should have done that could have in some way prevented the death of someone close to them, and that results in guilt, as I've already discussed. But even older children and adults often feel guilty when there's no logical, objective reason for them to feel responsible for a death. And as I mentioned, people may assume some responsibility, at least unconsciously, because it helps them believe that by taking different actions than they had done before, they can somehow prevent the future deaths of others for whom they feel deeply, and that gives them some illusion of control. So children who experience the death of a family member during the pandemic may question how they may have inadvertently exposed a family member to the virus. And we've added a lot to this through fear-based messages, telling children that, and young adults, if you go outside and socialize with others, maybe you'll be fine, but see the face of your grandparent every time you do that and know you could kill them. Well, then when the grandparent does die, they're even more likely to feel guilty. They may also wonder if they should have picked up on symptoms before the illness became more serious, or wondered if there was some way they could have gotten help earlier on in the illness to change the outcome. And this guilt continues to be an extremely common reaction with adolescents and adults. And for all these reasons, it's often helpful to reassure children and adults of their lack of responsibility for a death. I'm actually coming to the end, getting near the end of what I wanted to cover, but there are just a couple things more about what to do in classroom settings. So I wanted to talk about academic accommodations. If you go to the next slide. It's common for students to experience at least temporary academic challenges after the death of a family member or close friend, and you're going to see this as well from the majority of students dealing with a major crisis such as this pandemic. Pre-existing learning challenges often become worse and new challenges can present. This could be due to difficulty concentrating from disrupted sleep, anxiety, depression, and other causes, difficulty learning, remembering, or applying new concepts, challenges with completing homework. They may have completing obligations. I've been talking to people in some cities that were epicenters early on in the pandemic, and some of the adolescents were out trying to get money because their parents were unemployed or underemployed. But they may also, after a death, be taking care of other children, doing other chores or responsibility in the home, or there's just a lack of parental assistance, particularly if the parent has died, or other ways that the home environment is disrupted and makes it less conducive for them to do their homework. They may actually learn the material, but still have difficulty demonstrating the learning on tests. So it's important that we offer academic support proactively. Don't wait for students after a death to begin demonstrating academic challenges, and worst of all, don't wait for academic challenges to become academic failure. Schools can be a source of valuable support to grieving or traumatized students, but if academic expectations even temporarily exceed their current capacity to learn, school can often become a source of additional distress. So assist grieving students in identifying the level of academic work that just feels appropriate and achievable. Some helpful modifications are listed on the slide. You might, for example, change an assignment. For example, allow a student to work on a project with a partner rather than do it by themselves if they have trouble concentrating. Some students find it harder to collaborate when they're grieving, and they may actually prefer an option to work alone rather than complete a group project. You can suggest a student adapt a more formal research paper into more engaging assignments, such as an oral history project or a video. Some kids, when they're grieving, feel self-conscious, and the last thing they want is to be filmed or to stand in front of a group of people. The point I'm trying to make is that you make academic accommodations based on the need of the student at the time. It isn't that particular types of lessons are best or worst for them, but just that their needs may be different. You also want to change the focus or timing of certain lessons. A literature class might choose a different book to discuss if the one originally scheduled describes a death similar to the one the student is currently grieving. A health class on the dangers of substance abuse, for example, might be postponed, or the grieving student excused if the grieving student just lost a sibling to a drug overdose. You also should consider rescheduling or adapting tests. So immediately after a death, students who are grieving might be exempted from some testing or given modifications such as testing alone in a quiet location with additional time. Their scores might be omitted or weighted less in determining the final grades if they were obtained right after the death. You should consider 504 plans, or for children already in special education, modifications in their IEP. What you want to do is find a balance between maintaining reasonable expectations so kids do learn enough to be able to succeed in the subsequent school year, with being able to provide additional support and accommodations for their grief at the time. Now, I've had the opportunity to collaborate with numerous schools and districts throughout the country and abroad after some really devastating natural disasters and mass shootings in both schools and communities. And in many of these situations, I've just been impressed by the magnitude of the crisis and all the challenges that they pose. But I have actually become even more impressed by the resiliency of schools, school systems, and communities. And I'm confident that schools and communities will rise to the occasion. But being resilient doesn't mean that you don't experience distress. It just means you have the capacity within yourself or the system to cope with that distress. So I know this is going to be difficult, but I also know that schools are going to meet the enormous needs of their students as they did every day before the pandemic and will continue to do during and in the aftermath of the pandemic. And the National Center for School Crisis and Bereavement is committed to partnering with schools throughout the recovery period. If you go on to the next slide, Further information about the center and free resources can be found at schoolcrisiscenter.org. The banner at the top of the landing page will take you to the COVID-19 Pandemic Response Resources page. There you will find a guidance document on supporting grieving students during a pandemic, which will guide you to free video and print resources on the Coalition to Support Grieving Students webpage at grievingstudents.org. The COVID-19 Pandemic Response Resource page also has presentations for educators and parents on talking to and supporting children during the pandemic and supporting grieving children. And we also have helpful resources such as sample scripts for the first day back to school that a teacher can use to greet students and go over how to provide support. There are also links to COVID-19 pandemic response resources of other school professional organizations. If you go on to the next slide, I mentioned already the Coalition to Support Grieving Students. I just wanted to explain it's a unique collaboration of the leading professional organizations representing classroom educators, school administrators, and student support personnel, including school counselors, nurses, psychologists, and social workers, as well as other school professionals. They all came together with a common conviction that grieving students need the support and care of the school community. This slide lists the founding members of the coalition. The New York Life Foundation and the National Center for School Crisis and Bereavement are the lead founding members, but the other founding members are also listed, for example, including the AFT and the NEA, representing school teachers. And if you go on to the next slide, since the coalition was launched about 5 years ago, other groups have joined and supporting organizational members, some of which are listed on this slide. We actually now have more than 100 member organizations in the coalition. And if you go to the next slide, this coalition created a free school practitioner-oriented website, grievingstudents.org, that houses over 20 video-based training modules, most of which are just 10 to 15 minutes in length. And there's also a wide range of free print materials. We also have a grief-sensitive schools initiative that individual schools can apply to, or they can sign up, I should say, and they pledge to be grief sensitive. They can receive a 15-minute presentation from an ambassador from New York Life that can be delivered at this point remotely, as well as some educational materials that we developed, and they can qualify for a $500 grant just by accepting those resources. And if you go on to the next slide, this is one of the free materials that you can get from the website. Just click on Order Free Materials on the website. And this is a parent booklet after a loved one dies that can be downloaded in multiple languages as PDF, and it can be ordered in print copies in English and Spanish. And actually, even the shipping and handling is free of charge, thanks to the support from the New York Life Foundation. And this last slide provides contact information for the National Center for School Crisis and Bereavement in case you'd like some further information. And at this point, I'm going to turn this over for some questions and discussion. And thank you for your attention.
Thank you, David. Our first question is, how will we know if academic performance problems and/or changes are a result of crisis, difficult adjustment, or from the virtual learning and regression?
Okay, so this is a good question. It's the same thing with sleep problems. Really, any of the adjustment difficulties are non-specific. And I would say to a certain degree that in most cases, most of the accommodations, doesn't matter which one it is. So if a child is having learning problems because they have a developmental learning disorder, I'm a developmental behavioral pediatrician, you're going to want to do some testing and figure that out if that's what you suspect. But if you don't know, is it because the parents are arguing and undergoing a divorce, or is it from the pandemic, or is it because they're upset that a friend died, your academic accommodations are going to be comparable. And so go ahead as a classroom educator and provide that support. And then I would suggest you maybe ask the family a little bit more if they have an idea. And so, for example, if they're grieving, maybe they can join a bereavement support group in the school or in the community, because they probably still have some distress from that. But you'll refer them on to school mental health professionals and their own mental health and pediatric professionals, and they can try and work on whatever is upsetting them. But you don't necessarily have to figure out which thing is causing which problem. Just you need to know there's a problem and get them some support And then in school, help them learn while they're distressed.
The next question, David, is what questions are most important to ask of students and families to get a sense of each individual student's experiences during school closures and to what level they will require support?
Yeah, so first off, I do want to clarify that your goal as a classroom educator is to try and help children learn and be supportive to them and help them identify how they can get additional support. You're not trying to provide counseling to them. So you don't really want to elicit their full trauma histories. So if children have had very difficult experiences, we want to at least say this pandemic has caused a lot of difficulties for children. There may be things that were going on during this pandemic, such as people who got sick or died that may affect you directly or indirectly. You may have other stresses in your life, problems with food insecurity, or don't have a safe place to live each night. Or you may be experiencing some of the racial inequalities that we're hearing about in the news. Please know that whatever is affecting you, we are here to try and help you. But I think if you try and elicit all of the details of all of their difficult experiences, that can lead to what we call compassion fatigue and vicarious traumatization. So the goal of educators is not to try and find out everything that's been bad. I think they'll just get overwhelmed if they hear everything that's bad, but rather to let people know that you understand there may be difficulties and that you can connect them with people that can help them with that and talk to them about that further. And you're there to help them learn and feel supported. So there are, people ask, are there screening instruments? There are screening instruments that can look for a wide range of mental health concerns, but you have to be able to then provide those mental health services once you screen for them. So right now, we know in New York City, for example, 6 months after 9/11, we're about 6 months out from the crisis here. When they looked at, they surveyed over 8,000 students across all 5 boroughs in grades 4 through 12. And they actually found that over 25% of the children self-reported symptoms consistent with a mental health diagnosis. And 87%, so nearly 9 out of 10 children, reported at least one symptom that could be due to trauma. So I would say that at this point, we should anticipate that virtually all the kids are going to experience some distress. And I think we should be doing a lot of attention now in universal supports, tier 1 services, where we're providing support to all children and staff, and then let them know where else they can go for additional support. So it's a long way of saying I would start out by supporting kids and then see when that's not enough. And of course, if a kid talks about, I'm thinking of killing myself, then that goes immediately to tier 3 services. But if the kid's just saying, I couldn't do my homework last night, you explore, okay, how can we set it up so that you're more likely to do your homework? You don't necessarily have to explore exactly why. I think, because I think that's going to be just very difficult and overwhelming for educators to try and do at this point.
Thank you, David. Our next question, what should we do if students are sharing details of their loss with other students during class, especially if the parent does not want school professionals to discuss the loss with them?
Okay, so in our guide, we have guidance documents on the website about what to do when there's been a death of a student or staff member in a school, and we have actually one just specifically on suicide, and it goes over step-by-step guidelines. I think if children are sharing their loss experience, first off, recognize they are going to do that, and I think that's appropriate. So it's not something that you're going to want to discuss as a class, but you probably do want to at least recognize it. So if one of the students starts saying, my mom died, this is what happened, kids are going to be asking about that. But I think what I would say is, Tom, that sounds like that was a really very difficult experience for you. I'd like all of us to be able to help support you through this, and maybe we can talk about what we can do to help. Not so much let's talk about the circumstances of the death, but in school you can talk about how can we be helpful. Do you want another student to help take notes for you? Can you let us know if something is difficult for you, or we say something that makes you feel uncomfortable because it reminds you of something that was very hard? And then you can say, and I know this is something that's really important to you, I think it's best we talk about that alone. So let me set up some time to talk with you when we're done with class today. I can also find someone else who can talk further with you within the school. I'm so sorry to hear about what happened with your mom. So you validate their feelings and their reactions, and then rechannel the discussion back to what you think is appropriate for class without telling the kid they did something wrong by asking about it, without minimizing their distress, and letting them know you will address it at another point very soon.
Okay, we have a couple questions, David, about assessing students in terms of if the psychological problem is innate and permanent or just temporary due to COVID anxiety. You know, how do they assess for emotional disturbance, ruling out environmental factors, as well as just assessing where the student is at the moment?
Yeah, so assessment is complicated because there's so much going on. And so part of what you're going to be doing is, first off, informal assessment. You know, kid has his head down. He's turned his camera off most of the time. If you're doing remote lessons, it's really difficult. So you have to kind of articulate to people, look, I can't see everything that's going on. Sometimes your cameras are going to be off. I don't know if you're upset or if you've lost Wi-Fi signal. So I'm going to check in periodically with you. Or maybe you ask people to put in the chat box, tell me how you're feeling right at this moment. Pick an emoticon. You know, you're not asking them to disclose their deep personal secrets, but they can pick an emoticon. Am I happy? Am I sad? I have to say that doesn't work well for me because I actually can't tell what the different emoticons mean. Can't tell if the person's crying or joyful. So you might pick something else. We'll have to do that also if the kids return in class and you're wearing masks. And you'll have to say things like, I can't see whether or not you're smiling. So we're going to have to figure out how do we let each other know how we're feeling if we can't use that. There are other ways of telling. You don't have to just use facial, at least expressions of your mouth, but people rely on that. So your teacher can model that and say, Johnny, you just answered a really hard question. You can't tell, but I'm smiling, a big smile right now. That really shows me that you've learned that. That's great. So you model it. For young children, for example, some SEL, social emotional learning curricula, actually have little cards that they're on their desk, and the kids can just turn to the facial expression that matches how they're feeling, so that when teachers were able to walk through the class, they could see that. So we have to figure out sometimes some creative ways. And I would ask the kids to join in a discussion with you. The example that I use in some of the scripts is sometimes when we're texting, we have to use expressions like LOL because people can't tell that we're actually laughing. Or we have to use emoticons to show people how we're feeling because we can't see that in a text message. We'll have to figure something else out in the class and ask them. Maybe that's one of the first things you do as a class. I think you start with these informal assessments, and then you move to more formal assessments if they're more significant problems. Obviously, if they're voicing symptoms that you think are major depression, suicidality, substance use, then you bring in school mental health professionals to help you do more assessment in those situations. But you're probably going to start with informal assessment and then do more when it's persistent, more severe, or more worrisome in terms of what you see.
And last question, David, because we're going to be running out of time, I think, is there are two populations that people are asking for recommendations from you to address, and that's children who are stress eating, recommendations for that, and recommendations for children with autism.
Okay, so for children with autism, let me start with grief with children with autism. We actually do have a handout that it was just posted last night on grief for children with intellectual disabilities and neurodevelopmental disabilities. Children who can't express themselves as well verbally may actually communicate their distress in other ways, such as through changes in their behavior, more sensitivity, I should say, to changes in structure or routine, more self-stimulatory behavior. So you look for different signs with them, and the way you help support them varies in large part based on what are their usual self-soothing techniques. And so I think you'll find that it's written for bereavement because it's on the Coalition website, but it also will be relevant for dealing with kids in distress. For children who are overeating or undereating, I think that's something that you're going to probably want to ask them to speak to their healthcare provider about, so that they can make sure that they've resumed a healthier diet, and to explore the reasons why they are overeating or undereating, and see if you can, intervene in that way. You may be able to also, ask a school mental health provider or such as a school social worker. It may be that there's lots of reasons, like they don't have access to healthy foods as much. They're relying more on fast foods. You have to realize right now I'm in Southern California and the temperatures are like at 100. So my family doesn't want to use the oven. So then you tend to go more to fast foods or takeout. So there's just so many reasons why people may have disordered eating during a pandemic. So you'll probably want to have someone else explore that with the child. And again, I'm not trying to say classroom educators can't do a lot of great things with kids, but I think they also have to be realistic about how much they can do with all of their students. And a lot, I think, is they have to try and figure out when somebody really needs help and get them to the right person. And then also figure out how to give some general support, and then figure out how kids and families can get more support for things that might be helpful to them, so that they can still continue to teach and not get overwhelmed by all the problems everyone has.
So we are at our time, 1:15. I want to apologize for those questions that we did not get to live. However, we will be uploading on our website the questions that have not been answered and answers to those questions after the conference. So David, I want to thank you. I'm going to turn it back to our host, Anne.
Hello, and thank you again, Dr. Schoenfeld, for your wonderful presentation. We really appreciate it, and for all the active participation in the chat and the questions. As PJ said, we're sorry that we weren't able to get to all of them. We will add some of the resources that Dr. Schoenfeld mentioned. There's a lot of interest in the one that you had just mentioned about working with students with autism or other intellectual or developmental disabilities. So we'll find that one and get it posted on our website. So thank you to everyone. We do have another 15-minute break before we come back for our last session of the day. So please do take a minute and then come back and join us for session 4. Thank you again, Dr. Schoenfeld, and to all who've attended.
Thank you.